This is a demonstration of Allscripts Professional EHR for cardiology. Today we're going to demonstrate how Allscripts Professional EHR can overcome your daily challenges and help you achieve meaningful use. In cardiology practices, most providers are challenged with medication reconciliation, quick and easy access to labs and procedure results, easy access to outside reports, quick access to procedure notes, and disease management. Allscripts Professional EHR can help make your life a lot easier with the real-time automated medication list, up-to-date result notifications for labs and procedures, a face sheet for quick view of outside reports, as well as for easy access to procedure notes and automatic alerts for clinical decision support for disease management. Now let's take a look at Allscripts Professional EHR to see how we can meet your needs. You'll notice in the top right-hand corner that you're logged in as Dr. Thomas Hart. Dr. Hart's schedule for today shows all of his patients, the status of their appointment, the time they checked in, what time the chart was started, and what time the patient checked out. You can also see here to the far right why the patient is here. The patient you're going to look at today is Dale Darden, who is here for AFib. The nurse has already started the chart by entering in his history, including his meds list, his allergies, his problem list, and she's also taken his vitals and other items. So the nurse has already sent the note to the provider, to this inbox, which we'll call his queues. In the queues, you'll notice it says Received Charts. Once you select Received Charts, you can very quickly see where your patients are. You have one patient in exam room 5, another patient in exam room 6. His name is highlighted in red because the nurse put an alert on his chart. The moment you open his chart, it tells you the patient is tired of waiting. This is a sticky note that will not be permanent to the record. Once you select that, you're also given a reminder, a clinical alert that this patient needs LDL testing. This is for clinical decision support, telling you what's needed for this patient automatically anytime you open this record. You'll see the nurse has documented his complaint, updated his problem list, his allergy list, and his meds list, which is meeting meaningful use requirements. She's also entered in his vitals and his review of systems. The items displayed in red show you things that are abnormal for this patient in this visit. Looking at the note that's been entered by the nurse, you're going to pay attention to the top part of the screen, the patient banner. You have a photo of the patient in case you can't remember what he looks like or if you haven't seen him in a while. Here's his demographic information. And then to the far left, you can see any results that are back for this patient. His metabolic panel, for example. His results are back. You're ready to sign off on those results. If you want to make an annotation, you can easily do that or even send a message to your nurse. By hitting OK, you've actually signed off on that result. The face sheet allows you to see his entire chart. His history, any encounters and items that have been scanned in from outside reports, as well as things that have been documented within the chart, like a procedure. To view those, you can simply select Explore to go to the category that you want to view. You can look at this by date. Simply selecting it shows the date of service with the note on the right. You can also look at it by category. You can see any EKGs that have been scanned into the chart as well as any outside notes that were scanned in by the primary care physician. Picking up where the nurse left off, you walk into the exam room, speak to the patient, and continue to document his visit. The next item in the list is the physical exam. So the template that you're using, called AFib, atrial fibrillation, also pulls in the correct physical exam for AFib. When you select Apply, it actually pulls in the normal AFib template for a physical exam. So here you're looking at a typical AFib template for any patient. For this particular patient, his rhythm is a little different. You select that in the note and it brings you to your list of choices. Make the change that you want, highlight it, and now you see the change indicated in the note. For educational purposes, you can also bring an anatomical picture, draw on that diagram, and explain to the patient exactly what's going on with their heart. That will be saved to the patient's record permanently. The final note for the physical exam shows here, with everything in place. If you want to look at the entire visit before you finish, there's a note where the nurse has added in her portion and where the doctor has come in and documented his piece. Now you'll jump into Assessment and Plan and finish out the visit. When you select the Assessment and Plan under your AFib template, you see the protocol for AFib with the ICD-9 code already pulled in. There's nothing for you to search for. There's the Coumadin that you want to prescribe, you want to order these labs, and these orders for his echo. You'll give him an education sheet on AFib, and you want the patient to come back in 1 month. If these are your orders, all you need to do is select that problem. It already exists in this chart because it does a recheck. You select the diagnosis from this chart, along with the Coumadin that has already been documented in his record, and you're going to order the stress test. All that's been pulled in and already written out. The question mark on his Coumadin tells you that it's not covered on his insurance. You have the ability to write a different prescription that is covered under the patient's formulary. Also, you'll notice again the education sheet for AFib is already loaded. It can be printed out at the time of checkout. If you look at the final note again, it now includes the assessment and plan. You're ready to sign off, but before you do that, run the E&M calculator, which will suggest a level of service based on the documentation. You've documented that. You've written a prescription, and the system will run through and suggest a level of service. This has given 99213. If you want to see why, click Summary, and it tells you that the history was detailed with 6 elements found in HPI based on your documentation, as well as the nurses, and anything else that you may have missed. In order to achieve a comprehensive history, you have to document at least 10 review of systems, where you've only documented 3 thus far. It's a very nice way of looking at what's been missed or what things you need to go back to in the patient's note and address. Satisfied with that, you're going to sign off on the visit. Once you sign off, the system will generate a super bill. The super bill will go back seamlessly to the Allscripts practice management system for the billing. Here's the office code that's been automatically suggested. You can always override that if you need to. Here's the ICD-9 code for the AFib, along with the orders that have been placed, the stress test, and here at the bottom you have the ability to generate what we call an encounter pack. The encounter pack is a very nice way for the provider to have certain documents automatically generated at the end of the visit. For example, a referral letter back to their primary care physician, and a clinical summary for meaningful use requirements that says to the patient, here's everything we discussed during the visit. So it's a clinical summary of that visit, and you're going to also e-prescribe those medications. With one selection here, you're able to generate all 3 of those items at one time. You'll see Dale Darden's preferred pharmacy is Ralph's. Here's the actual prescription written out for Coumadin. And now you're going to generate those 2 letters. First, you'll see the letter back to the primary care physician, Dr. Ennis. This letter has been pulled directly from the note using only the items that you want to pull into the letter. This is the letter that Dr. Hart likes to send out to his primary care physicians, with his signature already in place. Now you'll notice that it says this patient is a very pleasant individual. You know that's not exactly true. You can select the Edit button and remove that from the letter. You have the ability to customize this letter on the fly. You'll go back and preview it and see that description is no longer there. The clinical summary allows you to meet the meaningful use requirements by generating this summary and having that printed at the end of the visit. The summary is captured automatically as you document, and it will be saved to the chart. Finally, if you wanted to look at a meaningful use report, you can certainly select that report here. As the owner of the practice, you want to see how your partners are doing as they are meeting meaningful use or not. You'll notice here it's detailing where each provider falls. Dr. Hart is at 81% in meeting meaningful use for entering vitals. That's an automated function where the report can run on a schedule and that data is captured seamlessly. Allscripts Professional EHR not only addresses your daily challenges, but connects to 180,000 physician users, 1,500 hospitals, third-party devices and applications, labs and pharmacies across the country. Allscripts practice management solution seamlessly. The Allscripts referral network, to patients through the patient portal, to patient charts remotely with our Allscripts Remote for Apple iPhone, iPod Touch, BlackBerry, or any Windows mobile device. It is your entire healthcare community connected. To request a custom ROI assessment or a personal product demonstration, please call Allscripts at 1-877-EHR-NOW1 or email ehrnow@allscripts.com or visit www.allscripts.com/professional.